let's talk about teeth bleaching. Getting nice, more beautiful white teeth. Well, one can go to the, I don't know, CVS store, to the Walmart, and buy a $20, $30 kit. And one can buy up to, I don't know, $600, $800 at the dentist for a Zoom white, for a laser, whatever the heck. And there's things in between. The dentist supervised with a tray and all that stuff. What's to it?
Okay, well, first of all, let's start at the beginning. A lot of the dentifrices now have bleaching gel in them. The Arm & Hammer Advanced White with the whitening booster that they have do help to have a bleaching effect on the teeth. Rembrandt makes a kit with 5 little tubes of Rembrandt toothpaste that has bleaching gel in it, which helps to whiten the teeth. There's also the whitening strips that you can get. The problem with the whitening strips is that it's a flat strip, and the bleaching material doesn't get in between the teeth as well as with a bleaching gel. The other method is what most dentists use. You have bleaching trays made up from impressions of your mouth that fit your mouth exactly. Go in between the teeth, and it's almost like a mouth guard that snaps over the teeth. You can wear the trays during the day for a couple of hours, or for patients that are very busy and active during the day, they can put a little bleaching gel inside these trays, snap them in before they go to bed at night, and leave them in overnight for 4 to 5 hours or 6 hours, whatever they sleep. And this works very nicely because the bleaching gel is in contact with the surface of the teeth for a 6 to 8 hour period. Most patients that use these, usually in a week to 10 days, 2 weeks at the most, they can achieve a nice whitening effect on the teeth. And lastly is the in-office bleaching, which is the Zoom whitening, or the whitening that's done with a plasma light. This is usually a 45-minute treatment where gel is placed on the teeth, and it's a very concentrated gel. It's about 30 to 35% peroxide solution, carbamide peroxide. The inside of the mouth is shielded with cotton and the like so that it doesn't get onto the gums or the tissues, because if it does, it tends to slightly burn the tissues, turn them a little white. The gel is placed on the teeth, and then a high-intensity plasma light is put over it for about 45 minutes, which helps to bleach the teeth to a nice white color directly in the office. It's a one-visit treatment. And then to maintain it, the patients can be given the bleaching trays with the gel, and they can be instructed if, due to their habits of drinking black coffee or tea or smoking or whatever, they notice that after a few months the teeth start to turn dark again, they can put a little bleaching gel in the trays, snap them in, and maybe a few nights, 2 or 3 nights, they can bring them back to their original whiteness again. So that's pretty much the story with the bleaching. All of these methods work. Probably the most effective are the bleaching trays you can get from a dentist with the bleaching gel that he gives you, or the Zoom whitening, which can be done directly in the office. The advantage to that is it's done in a 45-minute treatment. It's a one-visit thing, and you don't have to go through the week to 10-day cycle that you would if you took it home yourself, and you can walk out of the office with a bright smile.
Interesting. Okay, wonderful. Now, is there anything people who try it with the, tray at home and this strip and whatever type of stuff, they should be aware of, such as if they have fillings in their teeth, if they have, is there something they should be aware of that this will never work.
Well, it works, but they have to have their mouth in good condition before they do it. In other words, all the cavities should be fixed, because if the bleaching gel gets in there, it can cause toothaches. Some teeth, even if they are restored well, are a little more sensitive than others. But if the bleaching gel causes the teeth to become sensitive, they can rinse out before they put the gel on with a fluoride rinse, such as AIM or one of these fluoride rinses that they can get from the supermarket. All they have to do is brush their teeth, rinse out with the fluoride rinse. The fluoride will help to desensitize the teeth enough so that the bleaching gel really doesn't bother them that much, and then they can tolerate the gel.
Okay. So no harm done if they try something from the supermarket or whatever, and then if it works well enough, and if they have the discipline to go through, it might have definitely some workability, and if it's satisfactory to them, fine. And if not, they still always have the option to come to the dentist and go a step further with the zoom wide and stuff like that.
That's correct. And if their teeth are very sensitive and the AIM fluoride rinse doesn't work, the dentists have other things that they can give them that will work.
Okay. All right. Wonderful. Well, thanks a lot. That's it about bleaching teeth. So basically they all work a little bit and they all do the trick. Make sure your teeth are in good condition. They don't have, holes and fillings in it and etc. And if they're too sensitive, get your butt to the dentist. He'll do it. And if you want it convenient and be done in an hour, basically, there is an option to do that.
That's right.
Well, all right. Thanks a lot.
A pleasure.